How to release the psoas muscle at home. Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor therapist and certified birth healing practitioner, also a physical therapist that sees a lot of people with back pain related to the psoas muscle. So if you're watching this video, maybe you already know that you have some tightness in your psoas muscle. Maybe your massage therapist told you that. Maybe your physical therapist told you that. Maybe you just know intuitively that you have a lot of tightness in the psoas. So before I actually show you two techniques to release the psoas muscle at home, I want to tell you a little bit about the anatomy so that you know why we're going where we're going today. So let's get started. First off, quick anatomy lesson. So I'm going to show you this illustration. I do have permission to use this through Pelvic Guru. This is a great illustration of the psoas muscle. You can see one side here. Of course, you have one on the other side as well. So as we're looking here, we're looking at the front of the spine and pelvis, which I'm going to show you here in a little bit on a skeletal model as well. But we're looking here at an illustration. So you can see how the psoas muscles, they come down and they actually attach onto the diaphragm, which is a dome-shaped muscle underneath the rib cage, and onto the front side of the vertebra or the bones of your lower back and the discs in between the backbones. And they come down, and you can see now that this psoas muscle here meets up with this other muscle called the iliacus. And again, I'm going to show you that here in a little bit. But they blend together and they create what's called the iliopsoas. And it comes down and attaches really high up into the groin area. So they're a long complex of muscles, if you will. So it makes up the hip flexors, but it's made up of the psoas and the iliacus to form the iliopsoas. So here I have my spine model. So if you can imagine, we have the pelvis here as it goes around and it's circular. And then we have the spine that stacks all the way up to the top of the head. So as I turn this around, you can see the backbones here, okay, and all the way down to the sacrum. And then as we come from the front side, can you imagine those psoas muscles coming in and attaching onto the front side of these bones in your lower back? They come down into this part of the hip, okay? They meet up with the iliacus, which is right along the inside of this hip or pelvic bone. And then they meet together and they come down through the front of the hip. So generally speaking, think about it being in the middle of the body. So I can either touch it or try to touch it from the front side through the abdominal wall, or I can go from the back side through those back muscles. But it's deep in there, okay? It's kind of hard to feel, but I'm going to show you a couple different ways to release this muscle and also to stretch it. The first thing I'm going to show you today is a myofascial release. So to do this at home, what you're going to need is a ball. And you might even just gather a couple different types of balls, and I'm going to talk to you about that. And then also you may want a yoga mat. So what we're going to do is we're going to target the psoas muscle and do a myofascial release. I'm going to walk you through this. Basically, one option that you can have is an inflatable ball. Now, we give one of these to all of our new patients. So if you happen to be a patient of ours, great. Now you know how to use your ball a little bit more. If not, you can find a little playground ball somewhere between 4 to 6 inches in diameter, and you want to have one that's not going to collapse underneath the weight of your body. So with this, you can tell it's going to hold its shape, but it's going to have some give, some softness as I use it. On the other hand, you may use a yoga tune-up ball or a massage ball, a lacrosse ball, or even a tennis ball. Now this ball here, there's really not any give at all. It's very firm, it's very solid. It's not going to feel as comfortable starting out as something like this. A tennis ball is going to be somewhere kind of in the middle because a tennis ball is firm, but it has some give to it. So I'm going to use my soft ball here because I know it's going to feel a lot better to my body. What you're going to do on your mat is you're going to lie down face down and you're going to use the ball along the side of your body I'm going to show you on the right side. Keep in mind, if you have really tight psoas muscles, if it's painful, you can always choose to do this on a bed or a couch, something that's a little softer surface. But what I'm going to do here is come down to my side, and I'm going to find first my belly button. And then I'm going to come just to the side of my belly button to the right side, and I'm going to put that ball right there. Then what I'm going to do is just lie down over top of the ball. Now you can tell here I'm kind of propped myself up, And what I can do from there is kind of roll side to side, and I can find out, where does my body feel a little bit of discomfort or sensitivity, or maybe even a little pain. And I can choose to now come down a little bit further and let my body drape over that ball. If it's too intense for you, please give yourself permission to move it down a little bit, or up a little bit, or even to the side into an area that isn't quite as sensitive, because it's still going to work. It's still going to help you. You don't necessarily have to be directly on a very tight and painful spot. From here, what you can do is just rest down like this, and you can stack your hands and then look down towards the floor with your forehead resting on your hands. Now, I'm not going to stay here because I know it doesn't make for very great quality audio for a video. But you get the idea. You can rest like that. Sometimes I have people put like a pillow underneath their chest, and that can help soften it a little bit. You can even put a pillow underneath your shins when you're face down like this, and that's going to support your back a little bit more. Regardless, once you get in the position that you're in, and you're going to let the body drape over the ball, you're going to let the ball do its work, softening that area. The key here is that you hold long enough. So I want you to hold for 3 to 5 minutes, or maybe even a little longer. For a myofascial release, we just don't get in a hurry, okay? So you really want to make sure that you give your body enough time to let it soften and to do its job. I will say most of the patients that I talk to, if they've done something similar to this at home, they are trying to do it too quickly and it doesn't work. So they might hold 30 seconds or a minute, and that might seem like an eternity to hold for 3 to 5 minutes. I understand. However, the time element is the key to releasing the psoas muscle and to do a myofascial release. The other thing that I find is sometimes people they go in almost too aggressively, and they're using something like this massage ball that doesn't have any give, and they're doing it directly on a hard floor, and it's just too much for the body. So I want you to really give yourself permission to listen to what you're feeling and adjust it accordingly. So you have options. You can do this on the floor with a soft ball, okay? You could do it on a bed with a firmer ball, or you could even do it on the floor with a firm ball. But some days your body might be a little bit more uncomfortable or tight than other days. So always pay attention to what you're feeling at the time. And what you should find is after that 3 minutes or so, your body should feel like it's responding favorably and that it's actually releasing instead of just getting more and more uncomfortable, okay? Great. I hope that those techniques help you at home and that you're able to release your psoas muscle and feel better. Now, if this doesn't help you, I want to say, stick with it, give yourself enough time and consistency. And also, I want you to know, don't get discouraged, because sometimes this helps people and it helps them very significantly. And sometimes there's more going on than just a tight psoas muscle. Why is that muscle tight to begin with? What's the history there? Have you had an injury? There's a lot that goes into trying to help with tightness, soreness in the body, or even pain. And so sometimes a quick YouTube video is not the whole answer that you need. In that case, we would love for you to reach out to us here at the Healing Spot. You can head to our website, healingspotpt.com, and pick whatever option works out the best for you. You can meet with a member of our team for a discovery session and get all of your questions answered and find a customized plan moving forward for you, depending on what your goals are and what's been going on in your body. You can also check out the rest of our Ed Talk YouTube list and maybe find other videos that could be helpful for you as well. Those are free resources that we have on our YouTube channel. So peruse through that and hopefully you can find some more answers as well. We appreciate you being here and thank you so much for watching this Ed Talk. We'll see you on the next one.